So dear friends, let's discuss few minutes about the calcium channel blockers. So calcium channel blockers medicine available and prescribed by the doctors. Like we can see there are many medicines like the amlodipine. Amlodipine is the medicine for blood pressure. Amlodipine, phalodipine, isradipine, nicardipine, nifedipine, nisoldipine, verapamil. So there are many medicine. They are calcium channel blocker. तो ये कैल्शियम चैनल ब्लॉकर नाम की कई औषधियां होती हैं जो डॉक्टर प्रिस्क्राइब करते हैं बीपी को कम करने के लिए. दे आर गिविंग देम टू रिड्यूस द बीपी. And the amlodipine is one of the very common medicine. It's a highly common. तो इन्हें हम कहते हैं कैल्शियम चैनल ब्लॉकर्स. What is the meaning of that? So first we should know about the calcium. Calcium, what is the calcium? Because these medicine are lowering the blood pressure, and not only the blood pressure, they are also treating the chest pain and as well as the irregular heartbeat. ये बीपी को भी कम करते हैं, चेस्ट पेन को भी ठीक करते हैं, irregular heartbeat को भी ठीक करती है. So how the calcium channel blockers lowering the blood pressure? So the name itself is giving the story what's exactly happening if the person taking the medicine, if the person is taking this medicine like the amlodipine, then it will block the entry of calcium. अगर व्यक्ति ब्लड प्रेशर की दवा खाता है जैसे कि एम्लोडिपिन, तो ये इस दवा के खाने से कैल्शियम चैनल की एंट्री को ब्लॉक कर देगा. सो द कैल्शियम will not be able to enter in the heart and the arteries, in the cells of the heart and the arteries. Because what is the work of calcium? The calcium is responsible for contraction of the muscles, and the calcium is responsible for the squeezing of heart. अगर हार्ट को अपने आप को स्क्वीज करना, अगर हार्ट को खुद को कॉन्ट्रैक्ट करना है तो हर कॉन्ट्रैक्शन में कैल्शियम की आवश्यकता पड़ती है. So sometimes what's happening, there is a too much high heartbeat or the high blood pressure. So we are blocking the entry. Then calcium will not able to enter in the muscles of the heart, inside the cells of the heart. Then there will not be contraction, there will not be squeezing. तो contraction नहीं होगा, squeezing नहीं होगी. तो कैल्शियम चैनल ब्लॉकर वो दवाइयां हैं जिन दवाओं को अगर आप खाते हैं और आपके ब्लड में जाती हैं, फिर आपके शरीर में पाया जाने वाला कैल्शियम कई सारी जगह काम नहीं कर पाता क्योंकि उस कैल्शियम को ब्लॉक कर दिया जाता है. वो हार्ट की मसल के ऊपर काम नहीं कर पाता क्योंकि कैल्शियम की उपस्थिति में ही मसल का कॉन्ट्रैक्शन होता है, हार्ट का स्क्वीजिंग किया जाता है और जिसके परिणाम स्वरूप हार्ट ब्लड को पंप करता है. So by blocking the calcium channel blocker, then blood vessels will be more relaxed and open. There will not be contraction, there will be lesser contraction. So the calcium channel blocker are slowing the heart rate, lowering the blood pressure. Blood pressure को कम करते हैं, heartbeat को कम करते हैं. They are working on the angina pain and controlling the irregular heartbeat. So that's why we are also telling them कैल्शियम एंटागोनिस्ट, वो दवाइयां जो कैल्शियम के विरोध में काम करती हैं उसे एंटर नहीं करने देती। So there are two types of the calcium channel blockers. Number one, short acting. Number one, long acting. Short acting working very fast in the very short time, and the long acting working slowly and for the long term. एक तो वो हैं जो क्विकली काम करते हैं, जैसे शॉर्ट एक्टिंग का मतलब है कि उन्हें क्विकली काम करना पड़ेगा, तुरंत काम करना पड़ेगा। अभी आपका बीपी बहुत हाई है, अभी हम आपको शॉर्ट एक्टिंग दे देंगे, तुरंत कैल्शियम ब्लॉक कर दिया जाएगा। Short acting working very fast, very quickly, and working only for short time. That's why they are called short acting, maybe only for few hours. केवल कुछ घंटों के लिए काम करते हैं, इसीलिए उन्हें शॉर्ट एक्टिंग कहा जाता है। लेकिन जब हम लॉन्ग एक्टिंग की बात करते हैं, वो लंबे समय तक काम करते हैं। दे आर वर्किंग फॉर लॉन्गर ड्यूरेशन। द लॉन्ग एक्टिंग मेडिसिन, लॉन्ग एक्टिंग working for longer duration. So doctor prescribe medicine like the amlodipine. Amlodipine is blocking the calcium entry in the cells of the heart, in the arteries of the heart. So heart will not get squeezed. The heart muscle will not be contracting that much. So these medicines are very, very common. Anyone taking this medicine? Do you know if any of the patient belong to you taking these medicines? आपने amlodipine का नाम तो सुना ही होगा. It's a very highly common. Have you listened this name? Amlodipine, the medicines for the blood pressure. Yes. So many person already taking this. Yes. Amlodipine, it's a very common medicine, right? So there are many methods to control the high blood pressure. We already have learned whether you give the medicine who block the renin, it will control the high blood pressure. We have seen already. Or you give the medicine who block ACE, angiotensin converting enzyme, who is secreted from the lungs, they will balance the BP. Or you give the medicine who is not allowing angiotensin 2 to work, they will control the BP. Means this discussion already have done. So today we are discussing the medicine who is blocking the calcium also will able to reduce the BP. कि जो मेडिसिन आपके कैल्शियम चैनल को ब्लॉक, कैल्शियम की एंट्री को ब्लॉक कर देगी, उससे भी हम बीपी को कम कर सकते हैं. Yeah, in the ICU we used to many patients. Yes. So let's see now. But we have to always remember this thing. Each and every medication which is good as well as bad, having very good effect but also having some side effects. So the first we are discussing when the calcium channel blockers are used. आखिरकार कब जरूरत पड़ती है? Number one, when the person is suffering with a high blood pressure or the suffering with a coronary artery disease, so which is resulting the high blood pressure, and the person is having chest pain and also having high blood pressure, irregular heartbeat with a high blood pressure, and there are many blood vessels condition like the Raynaud's disease. Ultimately, we want to reduce the BP or the pulse rate. BP का कोई भी कारण हो, कोरोनरी आर्टरी डिसीज हो, छाती में दर्द हो, एंजाइना का पेन हो, हार्ट बीट इरेगुलर हो, ब्लड वेसल्स की कोई भी कंडीशन हो, इन सभी में कैल्शियम चैनल ब्लॉकर प्रिस्क्राइब किया जाता है डॉक्टर्स के द्वारा. So this is the research. The calcium channel blocker is working in the better way with the older people and with the black people, but it is not true 100%, right? It might be some division as per the ratio, like they have assembled the many black person and the white person. So working more for the black person, but it means it's not that it's not working for the white person. This is just a static data. कि बुढ़ापे में ज्यादा काम करता है, काले लोगों पर ज्यादा काम करता है, ये एक डाटा कलेक्ट किया गया है बस. So there are many other medicines like the beta blockers, ACE inhibitors, and the angiotensin 2 receptor blocker. Okay, we discussed already. So now let's talk about the side effect of calcium channel blocker, like the amlodipine. Number one very common side effect, that is constipation. It's a very common side effect. कि पहला साइड इफेक्ट है कि पेट साफ ना होना, डिजीनेस, palpitation, tiredness or the fatigue, flushing, flushing over the face mainly, headache, nausea, races over the skin, and swelling in the feet and the lower leg. So these are the common side effects. So many times when the person is getting this side effect very immediately after taking the amlodipine or any other calcium channel blocker, then doctor are changing the medication, right? So these are the common side effects. Now this is the general indication. The person who is taking calcium channel blocker also taking the grapefruit, so it might counteract the effect of this medicine. अगर कोई व्यक्ति ग्रेपफ्रूट लेता है तो ये कैल्शियम चैनल ब्लॉकर के प्रभाव को थोड़ा सा कम कर सकता है और इसमें इंटरफेयर कर सकता है, right? Then person might suffer with the headache and the dizziness. So because each and every medicine having interaction with some particular medication. So this was the quick discussion of the calcium channel blocker. Now in the previous class we have discussed that if you want to balance the mind, you need to balance two things. Number one, blood, and number two, yin. अगर आप मन को नियंत्रित करना चाहते हैं तो ब्लड को नियंत्रित करिए और यिन को नियंत्रित करिए. If the person is suffering with the blood deficiency, he may get some mind related disorders like the mood swings, memory loss, forgetfulness, lots of stress, overthinking and all. On the other side, if the person is suffering with a yin deficiency, also might get the Alzheimer's, multiple sclerosis, memory loss, and there are many other problems. तो व्यक्ति का अगर ब्लड और यिन ये दोनों बैलेंस है तो उसका मन ठीक रहने वाला है, नहीं तो नहीं. So remember one thing, as per the concept of acupuncture, who is controller of the blood? So it is the answer, the heart governs the blood. We are telling about the governor. Heart governs the blood. As per the concept of acupuncture, heart is governing the blood. So if there is something happening related with the blood, definitely we need to focus on the heart. And lungs is governing the chi. Right now we are talking about governor. Remember governor. एक्यूपंक्चर के सिद्धांतानुसार ब्लड का गवर्न करने वाला ऑर्गन है हार्ट और लंग्स को गवर्न करने वाला ऑर्गन है ची को गवर्न करने वाला ऑर्गन है लंग, राइट? So this concept we should remember. Now what's happening? If the person is suffering with the blood deficiency because of any reason, अगर व्यक्ति के शरीर में ब्लड की कमी है किसी भी कारणवश, तो उसे मानसिक रोग होने की पूरी संभावना है. Like for example, some person is suffering, some person is getting some accident, and because of the accident getting the bleeding, okay, or some person is having some internal injury, and because of the internal injury there is internal bleeding, or the some female is having excessive menstrual bleeding in the female. So bleeding because of any reason, whether because of the accident or because of the internal injury, maybe piles, the bleeding piles, or the colitis, any problem which is happening inside the body, or the menstruation, excessive menstrual bleeding. So bleeding because of any reason. अगर ब्लीडिंग होती है किसी भी कारण से, इससे फर्क नहीं पड़ता किस कारण से होती है. So slowly the person is suffering with the heart chi deficiency. Any types of the bleeding leading to the heart chi deficiency, किसी भी प्रकार की ब्लीडिंग हार्ट ची डेफिशिएंसी को लीड करती है. एनी टाइप्स ऑफ ब्लीडिंग. सो वी कैन टेल in the simple word, we can tell it like this: bleeding because of any reason. Any reason. Causing heart blood deficiency, and in the long term, long duration, it is leading to the heart chi deficiency. कि ब्लीडिंग किसी भी कारण से हो, पहले तो वो हार्ट ब्लड डेफिशिएंसी का रूप होती है, और बाद में चलकर कालांतर में धीरे धीरे वो हार्ट ची की डेफिशिएंसी बन जाती है. Now this is the sequence. Now this heart chi deficiency in the long term is becoming the heart yang deficiency, and body is getting cold. Body is getting cold. तो ये क्रम है. तो इस क्रम को फिर से समझेंगे ऐसे: ब्लीडिंग because of any reason. This is causing heart blood deficiency. Then it is converting in the heart chi deficiency. Still body is warm, and it is getting converted in the heart yang deficiency. Now body is becoming cold. So this is the sequence. ये sequence है, right? So when the person is getting the heart yang deficiency, means the body is becoming cold. So now the cold intolerance, the person is not able to bear the cold. So it's the final stage. That's why now we have to work a lot if we want to treat this condition. इस कंडीशन को ट्रीट करने के लिए अब बड़ी मेहनत लगने वाली है. So when the person is getting heart blood deficiency because of the bleeding, from here itself mind is disturbed, because mind is not getting the right रेजिडेंस, द रेजिडेंस ऑफ द माइंड इज द हार्ट। हमारे मन का आवास कौन है? हार्ट है। सो ड्यू टू हार्ट ब्लड डेफिशिएंसी, mind is not getting good residence or the strong residence. So mind is unstable. तो मन अस्थिर है, अनस्टेबल है, क्योंकि हार्ट तो मन का निवास स्थान है। So when the mind will be unstable, now what will happen? What mind can do? What the problem might happen in the mind? So the very simple problem in the mind, like worry, anxiety, get startled, चिंता करना, तनाव करना और छोटी छोटी बातों में चौंक जाना। गेट स्टार्टल मीन्स छोटी छोटी बातों में चौंक जाना। एंड इंसोम्निया, एंड इफ द स्लीप इज कमिंग, इट इज अ डिस्टर्ब स्लीप। This all happening just because of mind is disturbed, because mind is not getting proper residence. मन को सही घर नहीं मिल रहा है, mind is not getting the proper residence, and even mind is not able to think in the right way, not able to think in the right way. मन ठीक से सोच नहीं पा रहा है। Okay, so we have already discussed many times, but I would like to tell you, the person is suffering with a heart blood deficiency is sleeping very late, because he is not able to sleep. So just holding the mobile, just doing the chit chat, watching the Instagram, watching the WhatsApp, replying the WhatsApp, looking the TikTok, and passing the time till the 1 a.m. in the night. करवटें बदलता रहता है, क्योंकि मन स्थिर नहीं है, लेट सोता है। So when the person is sleeping very late, this person is sleeping very late, then getting up late. Now suppose because of some reason this person is not allowed to sleep till the late morning, because in the many family, the many person living together, and because of the family culture, everyone has to get up very early, then this person will be sleepy throughout the day, tired throughout the day, and will be having tiredness and lethargy throughout the day, because still sleep is incomplete. अगर इस व्यक्ति को सोने को नहीं मिलेगा तो ये व्यक्ति बड़ा बेचैन रहेगा, बड़ा परेशान रहेगा और सारा दिन थका हुआ रहेगा, और फिर दिन में सोकर अपनी थकान मिटाएगा। Then has to sleep during the afternoon, then will able to complete the sleep, then after sleep will be feeling comfortable. So this pattern is very common with the young female. Even this might be happen with the young male, but it's very common with the young female. यंग फीमेल के साथ यह पैटर्न बहुत ही कॉमन है, राइट? सो सपोज देयर आर टू पर्सन, वन इज यंग and one is old. This is a young person and this is the old person. If both are not able to sleep, so there are more chances the young person is suffering with the heart blood deficiency, but old person is suffering with some other pattern like the heart yin deficiency. अगर दो व्यक्ति हैं, एक है जवान और एक है बूढ़ा, दोनों नहीं सो पा रहे हैं, नॉट एबल टू स्लीप, तो मोस्ट प्रोबेबली जो बूढ़ा व्यक्ति है उसके अंदर यिन की कमी होगी, लेकिन जो जवान है उसके अंदर ब्लड की कमी होगी। सो दिस इज अ वेरी कॉमन साइन। Nowadays, one female is coming for the treatment that is 35 years, young female. Coming for the treatment for the pain of neck, middle back pain, lower back pain. These are the pain. Then weakness, dizziness at evening, and sleeping late night near about 12:30 a.m. in the night. Why? Because husband coming late, husband is having some business of car washing, coming late to the home near about 11:30, then they're taking the dinner together and sleeping by 12:30. I have told many times, oh, you have to take the dinner early and you have to sleep early, then, but she is not able to do because husband is throughout the day, he's outside. Now he's coming late, and then this female is taking the dinner very late and sleeping very late. तो ये फीमेल की उम्र 35 साल है, गर्दन में दर्द है, मिडिल बैक में पेन है, लोअर बैक में पेन है, जो उसका प्राइमरी कंसर्न है, शाम को चक्कर आते हैं और रात को देर से सोती है, मजबूरी है, केवल 2 ही लोग रहते हैं, हस्बैंड एंड वाइफ। उसने बहुत अच्छी बात बताई कल मुझे। She told me yesterday, doctor, oh, she told me, doctor, I have neck pain. Then I told, okay, I will send you one of my yoga video. You do that exercise. She told, doctor, I broke my mobile. Why? I throw on the floor with the anger. I did this second time. कि गुस्से में मोबाइल लिया और जमीन में पटक दिया, और दूसरी बार ऐसा किया, मैंने कहा मोबाइल क्यों पटका, एक कांच का गिलास पटक देते थोड़ा कम नुकसान होता है ना। But the person who is suffering with, because this anger, why this anger? Why? Because blood deficiency. I have seen many female patients, if they are having blood deficiency, they will be having too much anger. Sometimes this anger is really very high. Even the person, if these types of the person, sometimes is very worst condition, okay, reaching to the very worst condition. So see, this female is suffering with a blood deficiency, heart blood deficiency. She is having chest pain, palpitation. She is having neck pain, middle back pain, lower back pain. She is having dizziness, sleeping late night. Then I am giving the treatment of heart blood deficiency. मैं उसे heart blood deficiency का treatment दे रहा हूँ. She is much happier. Now she is getting better day by day. So my question is this. I'm asking you, tell me. There are two persons. One Mr. Ram and, okay, second Mr. Geeta, Ram or Geeta. Ram is suffering with the palpitation, and Geeta also suffering with the palpitation. Both are suffering with the palpitation. Ram and Geeta. Ram is the male, Geeta is the female. That you understood. It's clear. So my question is this. Geeta is getting palpitation in the evening time, but Ram is getting the palpitation during the daytime. कि राम को जो पाल्पिटेशन होता है, धड़कन बढ़ती है, दिन में बढ़ती है, 12 बजे, 1 बजे, 2 बजे, या सुबह के समय, ऑफिस जाते समय, और गीता को बढ़ती है धड़कन शाम को। तो बताओ दोनों की डायग्नोसिस क्या होगी? टेल मी। टेल मी, टेल मी, टेल मी। गीता की धड़कनें रात को बढ़ती हैं। गीता रात को गाना गाती है, धक धक करने लगा, और राम गाता है दिन में, धक धक करने लगा। तो दोनों को क्या कह दूं, किस में गड़बड़ है बताइए? शाम होते गीता का गाना चालू। ओके, सो आई विल टेल यू नाउ। ध्यान रखिएगा, वेरी गुड डायग्नोस्टिक पॉइंट। NYC, हु इज NYC? राम ही यांग डेफिशिएंसी अगेन। ओके जी, चलिए मैं बताता हूँ, चलिए। चलिए पहले हम बात करते हैं गीता से। So there are two person, Ram and Gita. Palpitation. She is also having palpitation. The Gita is having palpitation at the evening time. Evening. And the Ram having palpitation during the daytime. So what is the difference? So the difference is this. Gita, who is having palpitation at the evening time, so dizziness at evening, palpitation at evening, or uneasiness at evening, is the sign of heart blood deficiency. This is a sign of heart blood deficiency, right? ये हार्ट ब्लड डेफिशिएंसी की निशानी है। तो जो भी हार्ट ब्लड डेफिशिएंसी की फीमेल्स होती हैं, रात शाम का समय थक जाती हैं, चक्कर आते हैं, अनइजीनेस लगती है, पाल्पिटेशन बढ़ जाता है, डिजीनेस होती है। So this is the sign of the heart blood deficiency. Now on the other side, if we talk about the RAM, if the person is getting palpitation during the day and person is getting palpitation by exertion or day, it is a sign of heart chi deficiency. This is the difference. So there are two persons. One is having daytime palpitation. It is a sign of heart chi deficiency. The another person having evening time palpitation. This is a sign of heart blood deficiency. So this is the differential diagnosis. तो जब भी हार्ट की डेफिशिएंसी होती है तो दिन के समय और मुख्य रूप से परिश्रम करने पर पाल्पिटेशन बढ़ जाता है, और जब हार्ट ब्लड की डेफिशिएंसी होती है तो शाम के समय बढ़ता है। द वन बिगर डिफरेंस, if the heart chi deficiency, it will increase on exertion. ये exertion पर बढ़ेगी. On the other side, the person is suffering with a heart blood deficiency. It might increase even during the resting time. तो राम जब मेहनत करता है तो उसका पाल्पिटेशन बढ़ जाता है और दिन में रहता है, और गीता कुछ ना करे तो भी पाल्पिटेशन रहता है, आराम करे तो भी पाल्पिटेशन रहता है. So Ram is doing the exertion, then palpitation increasing, but Gita is just sitting or the lying down, even the palpitation is increasing. So it means the palpitation who increase by doing the exertion, that is a sign of heart chi deficiency. And the palpitation who is there even without doing any work, that is a sign of heart blood deficiency. ये differential diagnosis है. तो हमने देखा कि एक लेडी, अब हम राम गीता को भूल जाते हैं क्योंकि दोनों कंडीशन दोनों के साथ हो सकती है, मेल के साथ भी हो सकती है, फीमेल के साथ भी हो सकती है. बोथ कंडीशन माइट हैपन विद एनीवन. नाउ वन फीमेल going from one room to the kitchen and getting palpitation, what is the meaning of that? एक फीमेल रूम से उठकर किचन तक गई और उसके पाल्पिटेशन चालू हो गया, क्या मतलब इसका? What is the meaning of that? There is a sign of heart chi deficiency, and it's very common with a female who is always having sadness, all the time sad, depressed, हमेशा दुखी रहना, ना खुश होना, ना सामने वाले को खुश होने देना, खुद खुश ना होना और आप खुश हो जाओ, हिम्मत है खुश होकर दिखा दो उनके सामने. एक दो बार खुश होगे फिर अगली बार आप भूल ही जाओगे कि खुशी क्या होती है. इतना पावरफुल उनका एनर्जी ऑरा होता है, हर किसी को वो सैडनेस इज द यिन. दे विल पुल यू इन द यिन. इफ यू सिट एवरी डे फॉर 30 minutes for 21 days, you will be permanent sad. You can try. You can try. Okay. But it also depends on your joy. If your joy is powerful, then you might pull toward the joy. So heart chi deficiency means palpitation while you do the exertion. आप मेहनत करो और धड़कनें बढ़ जाएं, उसे कहते हैं हार्ट ची डेफिशिएंसी. और एक फीमेल है जो बिस्तर पर लेटी है और लेटे लेटे चक्कर आ रहे हैं, आते हैं लेटे लेटे चक्कर आ रहे हैं. इतनी कमजोरी हो जाती है कि लेटे लेटे चक्कर आते. She is lying down, still getting the giddiness. What is the meaning of that? What is the meaning? If she is getting palpitation and the giddiness even on the bed, so when she is getting up from the bed, suppose she is lying down. Okay, she is lying down. Okay, so when she is getting up from the bed, holding your hand, many females, when they want to get up from the bed, even because they are resting also, they are getting giddiness and the palpitation. Have you seen someone like that? देखा होगा, ऐसे बहुत लोग हैं, बहुत देखा होगा. What is that? Blood deficiency or chi deficiency? वो क्या है? ब्लड की कमी और ची की कमी है. That is blood deficiency, heart blood deficiency. बस अर्जुन की तीर आंख की तरह, अर्जुन ने जो आंख को देखकर तीर चलाया था, हार्ट ब्लड डेफिशिएंसी का प्रोटोकॉल लगा दो, ठीक हो जाएगा, एकदम ठीक हो जाएगा, एकदम 100%. But you also have to work very properly, right? So fine. So we have discussed these two different conditions. If you don't know, the protocol, then go in the previous video. We already have discussed protocol again and again and multiple times. The protocol of the heart chi deficiency, the protocol of the heart blood deficiency, many times. One protocol we have repeated five times. So now, why the female are getting giddiness in the heart blood deficiency? The reason is very simple, because of the blood deficiency, there is not enough blood reaching to the brain. ब्लड डेफिशिएंसी के कारण ब्रेन तक पर्याप्त मात्रा में ब्लड नहीं पहुंच रहा है. या वी हैव डन होमवर्क आल्सो. ओके, हमारे ब्रेन तक पर्याप्त मात्रा में जब ब्लड नहीं पहुंचता है तो चक्कर आते हैं. ओके, सो नाउ लेट्स गो ahead. Suppose Geeta is suffering with what disease? Heart, chi or blood? ब्लड. अब गीता सफर कर रही है हार्ट ब्लड डेफिशिएंसी से. अब बनी रही तो स्प्लीन ची डेफिशिएंसी भी हो जाए, स्प्लीन कमजोर हो जाएगी. सो लेट्स सी, ट्राई टू अंडरस्टैंड दिस कंसेप्ट. Because when you are trying to do the treatment, suppose you want to do the treatment of the heart blood deficiency. Okay, and you are giving the protocol of the heart blood deficiency. But do not forget spleen. Because spleen is making the responsible for making the, first you are eating the food, spleen is converting in the food chi, and because of this food chi we are able to make the blood. So whenever you want to have a good results, wonderful results, like one female like Geeta is having palpitation even while resting. गीता को पाल्पिटेशन है, आराम करते समय भी पाल्पिटेशन है. And evening time is not good. Evening time she feels tired, she feels palpitation in the evening time. Now you want to treat the Geeta, so you will doing the treatment of the heart blood deficiency. आप heart blood deficiency का treatment करोगे, but with that do not forget spleen, because spleen is also responsible for making the blood. So do the treatment of the spleen chi deficiency. Now this is the complete protocol formation. इसके माध्यम से हम उसे पूरा ठीक कर पाएंगे. We will able to treat completely if we are working in this pattern. If we are working in this way, then we'll able to work. हम ऐसे करके ही ठीक कर सकते हैं. अगर आपने सोचा हम हार्ट ब्लड डेफिशिएंसी के पॉइंट लगाते जाओ और उधर स्प्लीन को भूल जाओ, तो आपको पूरी सफलता मिलना कठिन है. Not able to get the complete results, right? So now tell me, what is the protocol of the heart blood deficiency? Anyone? हार्ट ब्लड डेफिशिएंसी का प्रोटोकॉल बताइए, लिखिए चैट बॉक्स में. Write down the protocol of the heart blood deficiency, because we have discussed many times. Heart blood deficiency, the protocol of the heart blood deficiency. Heart is located in the chest cavity. And the distal point of the chest cavity will be the pericardium 6. So our first point will be the pericardium 6. हमारा पहला बिंदु पेरिकार्डियम 6 होगा। Now regarding the CV4, CV4 is the very wonderful point who improve blood, who improve yin, who improve yang, who improve jing, who improve chi. So the next point will be CV4. हमारा अगला point CV4 होगा। Now we are talking about the blood. So how can we forget urinary bladder 17, which is the influential point of blood? How can we forget the spleen 10, which is the special point of blood? हम ब्लड की बात कर रहे हैं तो UB17 जो ब्लड का इन्फ्लुएंशियल पॉइंट है और स्प्लीन 10 जो ब्लड का स्पेशल पॉइंट है, उसे हम कैसे भूल सकते हैं? बिल्कुल नहीं भूल सकते। Now we want to balance the heart, so we are taking the source point of the heart, as 7 is the source point of the heart, and finally we will be taking the front mu and the back su point of the heart. So the front mu point CV14, additional point 15, the back su point of the urinary bladder 15. So these are the front mu point and the back su point. Now finally we will be taking one more point, that is urinary bladder 20, which is the back su point of the spleen. This is the complete protocol, wonderful protocol. With the help of this protocol, we will able to treat heart blood deficiency. So let's see once again. So pericardium 6 is the distal point of chest. CV4 is the very good point for improving the jing, essence, yin, yang, blood, chi. Then we have taken the special point of the blood, that is urinary bladder 17 and the special spleen 10. Then we have taken heart 7, which is the source point of the heart. Then we have taken front view point and the back su point of heart, front view point CV14, additional point 15, back su point urinary bladder 15, and the back su point of spleen UB20. Wonderful protocol for the heart blood deficiency. ये हमारे हार्ट ब्लड डेफिशिएंसी का एक्सीलेंट प्रोटोकॉल है। अब इसके साथ हमें यूनाइट करना है स्प्लीन ची डेफिशिएंसी प्रोटोकॉल, spleen chi deficiency protocol. If we unite the spleen chi deficiency protocol, then Gita will be happy, because the problem of the Gita will disappear completely. The dizziness, palpitation, not feeling good enough during the evening time, giddiness, blood is not coming enough to the head region, every problem will be taken care. हर प्रॉब्लम को ठीक कर लिया जाएगा। अब हमें स्प्लीन ची डेफिशिएंसी का प्रोटोकॉल लगा देना है। व्हाट इज द प्रोटोकॉल ऑफ द स्प्लीन ची डेफिशिएंसी? स्प्लीन 6, stomach 36, CV12, urinary bladder 20, and the 21. Even there are few more points can be added, but the most wonderful point are these two. Even sometimes we are adding only 2 points, they are enough. इसमें ये point add कर देना है। UB20 हम पहले ले चुके हैं, we already have taken the UB20. So we can make the batch, maybe in the one sitting we can apply these protocols, and the second sitting we can apply this protocol. So we can do in that way, right? So this is an excellent protocol for heart blood deficiency and the spleen deficiency. Heart, suppose you don't want to make 2 batches. Okay, just you want to make only 1 batch, right? Only 1 batch. Then in the batch number 1, just add the CV12. CV12 and the UB20 are enough to strengthen the spleen. Only with the batch 1 we will able to work on the heart blood as well as the spleen chi. But remember one thing, do not allow this patient for cold cold drinks, cold coffee. If the person is living in the too much cold weather, drinking too much cold thing, it's not good, right? ये गजब ज़्यादा ठीक नहीं. So we'll be discussing in the upcoming class what will happen if we are not treating the disease on the right time, right? This blood deficiency might convert in the yin deficiency. Okay. ये जो ब्लड की डेफिशिएंसी है, ये यिन की डेफिशिएंसी में बदल सकती है. So we'll be discussing in the next class what will be the consequences, what will be the sequelae, what will happen next if we are not treating on the time. So we are discussing in the next class, right? So enough for today. आज के लिए इतना काफी है. अब हम अगली क्लास में मिलेंगे tomorrow. Let's meet tomorrow.